Hello again. I'm Emil Eriksson, and I work at Tandem Health. I'm software engineer and team lead. I'm not an IT technician. All right, let's start thinking about the problem we set out to solve before talking about the solution. And that problem is that way too much time is spent on medical administration. And that's a worldwide problem. 9 out of 10 primary care doctors can't finish their admin tasks during their normal working hours. 8 hours per week is spent by doctors on patient-related admin. And if you compare this with the 16 hours that they spend on patient meetings, you quickly see that at least 33% is spent on admin. 40% of nurses' working time is spent on administration as well. And this has been a long-standing problem with few good solutions. So this is where Tandem comes into the picture. Tandem was started 2 years ago. And what do? Well, we write the medical notes for the clinician. The way it works is that a doctor takes a patient, as usual, and they start a recording. We heard something about drum transcription earlier. We also do transcription, not of drums, but of this conversation. And we transcribe the entire meeting between the doctor and the patient. Given this transcription, of course, some well-chosen prompts, we automatically generate the clinical documentation. It works in 50+ languages, and we have traditional dictation, but this is really the selling point of generating structured notes. And it integrates with EHRs, which is the electronic healthcare records that you have to document the patient history. So let's talk about numbers. What I'm proud of at Tandem is that we built a truly useful product. And what I mean by that is that we've generated 2.2 million notes so far. And that's a pretty cool number if you think about all those notes being an interaction between a patient and their doctor, and time being saved for all of these. You can talk about revenue, you can talk about the number of users you have, but this is truly useful for the clinicians. It's not just a cool demo, it's not just something promising, it's something that's helping them right now with their admin tasks. I've also added this sort of humble number, which was that yesterday, 0.2% of all patient encounters in Europe used Tandem. It's a pretty small number, but I think it's pretty cool because it's not that small. And it's growing rapidly. And this is pretty cool for a company that was started 2 years ago. This is another number that we're very proud of, and that's 70% of our non-technical staff at Tandem has a clinical background. They are orthopedic surgeons, trauma surgeons, gynecologists, physiotherapists, psychologists. These are the people that work at Tandem and really understand how it feels like to be a clinician and do what the clinicians do. Now, since everything has gone so well for me, technically during this presentation, I figured I would actually do a short demo of how Tandem works, so you can get a better understanding. And I need to note that I'm not a doctor, so don't take any of my medical advice for real. But I would like to invite Patrick up to the stage as my patient.
I'm the patient.
Yes.
All right.
So, I've started the consultation here in Tandem, as you can see, and the Tandem is now listening. All right, welcome, Patrick. What brings you here today?
I have a headache.
Headache, okay. How long has that been going on, approximately?
3 weeks.
3 weeks, okay. And has it gotten worse or better, or how would you describe it?
It seems to be relating to sleep.
Okay, so when you get too much, I see, small kids at home. And is it when you get too much sleep or too little sleep that you get headaches?
It's when I get too little.
All right. Me, myself, I get headaches when I sleep too much, actually. All right. And do you have any other symptoms?
Not really.
No?
The headache is a problem.
Yes. Yeah, I bet. Yeah. And do you take any medication, like painkillers or anything similar to that?
No, should I?
Yes. I mean, that's an alternative if you wish to do so. Since I'm a doctor, I'm licensed to give you that advice as well. And I'm going to do a short examination of you here today, just to sort of check your vitals. So I'm listening to your heart, and it sounds normal. Listening to your lungs, they sound normal. And if I look inside your throat here, I can actually see some white there. So nothing troubling, but could be some sort of infection starting here. I'm also going to take your temperature, and I read 37.2 degrees, so no fever. All right, and sort of what brings you in here? What's the have you been worried about this, or what's the sort of reason?
I may lose my eyesight if it continues.
Okay, so you're worried that you're going to lose your eyesight if it continues. I don't think you need to be worried about that at this stage, actually.
But I read on the internet that cluster headaches can cause loss of eyesight.
All right, yeah. Yes, cluster headaches can cause that, but I don't think that might be the case right here. What you're describing to me, it doesn't sound like it. But I'm going to tell you what. My assessment is that you just have a headache and a common cold, probably. What you can do, so the plan that I have here is that you'll take ibuprofen. If it gets worse, you can take 3 a day, 400 milligrams. That's the standard dose. I wouldn't be too worried about the cluster headaches, but if it gets worse, please come back to us within 2 weeks. And do you have any other questions?
If I take the pills, can you take my kids?
I wish, but I too have kids at home, so
Thank you.
thank you very much. Big applause. All right, so a typical patient encounter, as you can tell. And you might have noticed that I was very present in this conversation. And if you've been to the doctor, maybe you've thought about the fact that they're taking notes, meanwhile either writing on the computer or they're writing on a paper. And as a patient, that can feel like the doctor's not listening to you or they're thinking about something else. And for the doctor as well, they need to be remembering everything that the patient said, and they need to take structured notes meanwhile. So I'm going to finish this, and it is finishing the transcribing and generating the medical note. So this is the note as they will then enter it into the medical record system. It has these, it's a template, so I have these all the structured headings. And you can see our conversation quite shortly summarized here. Headache, that's the reason for contact. Social history, small children at home, it caught that. History of present illness, headaches for 3 weeks, insufficient sleep. We also did the physical exam here. We have some standard phrases because even if I say that the heart sounded normal, it actually, doctor language would be no concerning features. The assessment that I gave was a headache and probable common cold, and the action and plan that I gave was ibuprofen and then follow up. And as you can tell, there's nothing about the cluster headaches in this note, because from the context of the conversation, it sort of understands that that's not the assessment here. We have another feature called add or adjust. So maybe you want to adjust something afterwards. I can say put the history of present illness on a bullet list. And add in the social history that the patient works as an astronaut. So I can do small edits like this. It says now that he works as an astronaut. Now our history of present illness is on the bullet list. And in the end here, you can see codes that we've generated. And these are medical codes that are used to sort of categorize and classify patient encounters. These are the 3 codes that we've surfaced. Headache, common cold, and hypertension type headache. And from this document, I can also create more documents. So let's say, for example, that Patrick needs to go on sick leave based on this encounter. I can generate a sick leave note, because that's the other stuff that you don't see as a patient, but the doctor needs to work or needs to do all of these things in the background as well. So now it says occupation, the patient works as an astronaut, for example, and the sort of impairments and the reasoning for the sick leave here. Yeah, that's the end of this demo, at least, and it went better than connecting my screen, so I'm glad. Guys. All right, so how does it work? We start off with the recording, and we have this Tandem branded mic that we give to the clinics, which is, it's nice because it has the little Tandem logo on it, but there's actually nothing special about it. It's just a regular conference mic. But a lot of clinics seem to think that the AI is actually within the puck, as they say, which we sometimes let them believe because we think it's fun. But any old mic works for this, as long as the audio quality is good. We also have a native Windows program that they can use, which can record the system audio, because a lot of patient encounters are through Teams, for example, or other tele encounters. Then we can also record their system audio. And we do audio compression of all the sound before we send it over the network with Opus compression. We used to not have audio compression, and they were asking why Tandem drained all their data in the first hour of using it. We managed to 30x, make it 30x smaller before sending it with audio compression. So they were quite happy about that. After recording, we do the transcription. We use the Whisper model by OpenAI. And we actually started in the Swedish market, and we really focused on the Swedish market. And the transcription quality wasn't quite good enough, especially not for medical jargon. So there's a lot of illnesses and medical jargon and medications in Swedish that the Whisper model obviously hasn't been trained for. So what we did is that we gathered about 25 hours of audio data, which was Swedish medical students reading medical jargon, recording it, and then sending it to us. And we used this data to fine-tune the decoding layer of the Whisper neural network, which is an open source model. So we could do that and achieve much better results in Swedish. We also correct the formatting, because the output from Whisper is not always very good, and correct the spelling as well. We also have added medical terminology, so some words that can sound similar to, for example, a common medication. We've sort of have prompting to make it correct those. And then comes the note generation step. So we take the transcription and a lot of well-placed prompts, and we use GPT-4o to generate the note. You might be asking, why not GPT-5? And the answer is that Azure up in Gävle, which is the Sweden central region, has not released it there yet. And we need to have it in Gävle because we're handling Swedish patient data. So we're promising the clinics that all their data is going to be handled just in Sweden. So we have to roll with whatever Azure is providing us at the moment. Then we generate the sections that you saw earlier, and we sort of early on found out that you can sort of split up a patient encounter into, for example, background and conclusion. So the background is everything that the patient reports, and the conclusion is sort of the assessment and the plan that the doctor comes with. And obviously we have a lot of template-specific prompts which say how should this exact heading be formulated. And the last step, which is very important, is that we need to transfer the note to their medical record system. So that means we've built a lot of integrations. We've built about 50 or more than 50 right now. And in Europe, there's roughly 500 in total. So, I mean, we've actually made quite a dent on how many integrations we need to make. And there's a finite amount that we need to do. But a lot of our work goes into that, building these integrations towards the systems. Because even though you have the best product in the world, a lot of hospitals and a lot of clinics aren't so keen on switching. And the way we do these integrations is We solve it as they come and are presented to us. We use RPA, for example, and APIs when there are APIs, which there seldom are, unfortunately. And iframe shenanigans, I mean, you name it, we just solve it, right? And a lot of times without the EHR's knowledge of it as well, because they don't want anything to do with us, but we still integrate towards them, even though they don't have an API. So people are usually quite impressed that we can do that, and it's a big selling point for us. So now that you've seen the demo here, you might be thinking to yourself, it's just taking this, it has a transcription service and it's just generating this structured note. That's what LLMs are made for. Maybe I'll just go home and maybe go into Lovable or natively and build my own Tandem app. And you can definitely do that and get something that looks like medical notes. But the thing that we've really focused on, that I mentioned earlier, is our clinical team at Tandem. These are some of our doctors, and they're the ones really building the product in cooperation with us. Because I don't know anything about patient encounters. I don't know anything about medical notes. So you might be asking yourself, like, as an AI engineer, how many hours am I spending each week on prompting? And the answer is very close to 0. These are the people doing all the prompts for us. And this clinical expertise is crucial for us to build a product that's really, really useful. And that's like I was saying earlier, that's the difference between having a promising demo or something that looks good, but once you put it in the hands of the clinicians, it's not going to be fine for them. Like, it looks good for us, but as soon as they start using it, they can't, for them, it's an unusable note. It just looks like a note. So we really have clinicians of all kinds that can help and specialize in all these areas. And if you don't believe me, this is one of our doctors, Dr. Roy, and this is a screenshot I took today of our GitHub repo, and it says Tandem Roy 304 commits. This was before we actually surfaced the prompts for them to edit in some interface. In the beginning, they were literally going to the code and updating the prompts and committing it. So all of them had to get, during the onboarding, they have to get a GitHub account. So that's how serious we take prompting here. So what are some of the challenges that we have faced so far? I mean, it is this thing of how do we really work with our clinical team to integrate their expertise with the technology that we're building, because they have a lot of ideas of how to build things, and we have to sort of communicate the limitations and opportunities to them. So most of our product syncs are both clinicians and engineers and design people and so on. We want to have something that works across clinics and across countries. I mean, it has to work for a Swedish veterinarian and it has to work for a German surgeon. And this is a really challenging problem because things obviously look different everywhere and have different contexts. And trying to collaborate clinicians, someone said, is like herding cats. They're very hard to sort of get to do what you want them to do. And we've really been focusing on how do we have best-in-class solution engineering. So our engineers are really focused on just solving problems. And whatever problems there are, you're looking at some Lithuanian medical record system from 1990s, and then you have to solve how to do the integration for that. And you can't have too many opinions on what you're going to be doing. We just have to work as a team and solve all the really hard engineering problems to deliver value to our clinicians. So I began by talking about how to generate the medical note, which is the thing that takes up the most time for the clinicians. That's what we began focusing on. But obviously, we are expanding on this, and we really want to assist on the full clinical workflow. And sometimes we call it like the medical operating system, but I can't fool you. It's not actually operating system, but it's a good analogy of what we're trying to achieve here. So, for example, when a patient comes in, we would like to summarize the patient history for the doctor so they can see quickly at a glance, what their history is. We want to have follow-up documentation, like you saw, the sick leave notes and the referrals and all the sort of documentation that you can imagine. We also want to support clinical decisions. And this is a hard one. This is a very tricky one because today doctors are basically illegally pasting patient data into ChatGPT. Obviously, that's not feasible, and we have to avoid that. But we really have to have good infrastructure and good understanding of how to avoid hallucinations and how to make good decisions, basically. And the way we're doing this is that we're going bottoms up. We're really giving clinicians something that they love and that they trust. And if they trust us to do this part, then they're more likely to trust us to do the other parts. Selling the whole thing as a platform, and especially going like from the bosses and down, and then them saying, you got to use this new tool because we're going to save a lot of money on it, that's not going to fly. So we've just only gone straight to the clinicians when we can and make them love it. And some of the clinicians have said, if they ever get rid of Tandem at my clinic, I'm going to have to switch clinics. So that's, I think, a pretty good mark of trust. And we obviously have to be on the bleeding edge of applying LLMs and building the LLM products. Thank you. And we're